time to revisit Tufts and meeting a lot of old friends and new friends. Last night at dinner, Michael asked me, why you stick to health literacy so much? And I will be asked such question, but also asking myself why. And actually the title of the how AI can connect it, AI already connected, good way and not so good way. So I actually not put this as a lecture. It's a lot of question to all audience and also myself. So back to the question Michael asked me. I was teaching health literacy and also established a health literacy association around Asia for a couple of years. And then one day I sent my mom to the hospital at her 90s. And she started to ask me a lot of questions. You know, she's the mom of a medical professor for many years. And she prayed that she knows a lot. You know, she catch up a lot of knowledge from television by the time. She was very bothered by APP. A lot of information from the family sent her too much. She said, too many, I don't understand. Why is that? Why she sent me this? Why you talk about that? This new information bombardment for an old lady, 89 years old. So when she came to the hospital, she really having the worst time in her life, how to survive by all the medical management or tortures without understanding. Every night I come to see her, she asks me a lot of questions, why she did that to me, and can I reject? So this already discussed in the past 1 hour about this debate and controversy. So I was in this journey, and we are very happy that these 3-4 parents and moderators talking about how AI in our life is already there. We cannot stop it. But now how are we going to survive? And so I was the president of Taiwan Association for Health Literacy and Communication. Not only, and I see the communication is really the key. And in the past few years, I was helping Philippines, Vietnam, Thailand, Malaysia to set up office, trying to promote health literacy in many ways. So why AI, health literacy, they are working together in terms of communication. So if AI is not serving us in healthcare or communication, we will be in even more disturbance. So let me go through a lot of picture, and I learned through life, we need to make things easier, understandable, right? It's a part of health literacy. If you talk about something people don't understand, means the health literacy technology, communication, teaching was not sufficient. So I was trying to use a lot of picture, a lot of entertainment, a little bit. 150 years ago, we started to have electric, actually it's an automobile. Only 150 years ago. And then we have a car, right? And immediately in a few years, you know, they make a lot of these kind of things for people. And now we have a problem. One of pictures from Taipei, one of questions from India, and maybe Seattle. So we are having enjoy the success of our achievement, but then we need to find a way to survive it. And then, well, we are having, luckily, we have a good design about many things, you know, even for handicapped people or people walking through with, you know, in Tokyo street, you see that when you walk through, they have a or you can walk over because people cannot see very well. And so even in the metropolitan system in New York, in Tokyo, even in Taipei with 7 million population, we build up a road, we need a rule, we need to follow the regulations. Finally, civilized, but every year, one of the biggest mortality in Taiwan, 3,000 people were killed on the road, not inside the house, but outside. You know, it's more than any of the world we have to went through. And okay, that not too long ago, we have this computer, 1945. Not too long ago. And then we have internet, 1969. And you know that from 1973. I was in the elementary schools. We started to have these mobile phones, and now more of this ICT and helping us in the healthcare, and people are connected. So Terence Hai said that everything in the morning, he didn't say, "Good morning, my dear." He talking "my dear" to the mobile phone, right? So in the morning, wake up, you look for your mobile phone. Where's my wife? Oh, it's you check where is. So that is human connect. Are we too serious about that? It's very difficult. I have a lot of patients. They said they cannot sleep well. I said, "How far you keep your mobile away?" They said, I have to keep because my daughter would send me a message and know what should I wake up in the morning to prepare breakfast. So they put the mobile next to pillow. Very bad. Never can sleep well, right? And so we have a healthcare system. We have ICT come, and how we can build a continuous good connection with. Now AI is every, and there are AI for healthcare. There are a lot, right? You can try many of them. But the problem, there's a few problems. People are getting older, and most of the people, I think somehow the population would fret, except India were helping us. Most of the time, I think in Taiwan population going down now. Finally. Like you have a very long day, right? And finally getting dark. The sun really getting dark. All right, we can really relax because it takes time to taking care of so many people. And so slowly, we will not have a lot of more people, but we have a lot of old people. They cannot do too much. And I'm one of the group. Well, a smartphone is related to health literacy. This is one of the studies showing better social care, social support, and health literacy. Apparently they are related, but if people with smartphone, right, on the top, they seem to be getting better social support, means they are more connected. Okay, so they are good sign, but health literacy, back to health literacy, we really having a lot of problem about, it's a problem, really headache. We find every time we have a study, we find people are so different in terms of health literacy. We just, the gap is bigger. The more we study health literacy, we find people are more different, right? The diversity is good for us, I don't know, but the health literacy gap is wider. Are we going to narrow down? That is a good question. This is a study done in Europe and in Asia. We can tell. Every time we did a study, we most of the time scientists want to find a difference, right? Oh, you are different from the other. These countries, they are from we find a difference that we can publish. But on the other side, for global health, it's not good, right? Can we find a study that people intervention and become better in communication? We can living in more harmonized. That is the dilemma for myself. Are we going to find more difference? For example, a father or church say that, well, after many years working in the same, then find there's more problem, right? Certainly you continue to come to helping, but I don't know how long. Right now, the problem about the addiction of the smartphone and interaction. So this is a study over here. Suicide thought, female having high. I think Sydney or maybe touching about that. Getting a smartphone and really addicted. And in let's say 4 hours a day on social media. In Taiwan, 3 hours. Too much. They have 3 minutes for the parents only, but 3 hours on mobile. Okay, who are really the parents? Okay, and so it's a 3 hour throughout the world. It's not only USA and Taiwan. Throughout the world, and I show you in North America. This is which country? Brazil. Wow, they have so much time to spend on. They have 4.5 hours every day on social media, okay? And Colombia 4.1 hours. And well, USA is not as high as in those. It's only 2.2, but in Mexico, Turkey, Portugal, they have many hours. In Taiwan, in only any of us, I was trying to do some survey. What are they looking at? You know, everyone is mobile. What are they looking? Are they looking at the next appointment, or are they looking at the scientific article? No, they go through the Facebook, IG, and every second they go through it. See, and 3 hours a day. Okay, so there was something that people want to have some regulation. Australia, Spain already asked kids too young, they cannot on the social media too much. How much would adult go above 50 to trust AI? I think Cindy or many of you already mentioned. We still not, better we don't trust them immediately, right? We cannot just say, oh, we like AI. I think but how much we can trust them? So there was a lot of ethical roadmap already come out. I believe you understand more than me. And there's a WHO, ITU, start to have open code initiative about data acquisition package, data storage package, etc. You know, but it's in the global picture. Unfortunately, it stopped 2 years ago. I don't know why they stopped. And in Europe, they have a European health data space. I'm talking about health now. In Taiwan, okay, we are enjoying a high percentage of utility of mobile, smartphone, internet, and AI. You know, the government do not control too much about AI. You know, government is really promoting. We want to be the best in using AI in everything. Okay. Design the cuisine or whatever. At this moment, maybe they start to change in 2 years. You know? So Taiwan is spending a lot of time, energy, money, funding. I talked with some colleagues that our hospital receive a lot of money, a lot of new funding that they want us to try to use different things, new things. AI certainly one of the example. So I'm going to talk a little bit about how we're going to face this. This is a little bit achievement of the health literacy development we have done since 2017 and recently. Public health literacy, share smart decision, health literacy organization. This is all on the item, the jobs. Okay, so 2015, if you look at this picture, you see there's a young fellow come to us. You really link Pacific, North America and Asia together. So since then we already done a lot on that. The final part of my presentation is what the challenge or what we are doing in Taiwan. In healthcare quality, I think quality individually, USA was #1 in the world. But if you look at it in general, efficiency, I don't know how much time you have to wait to make appointment to see Professor Dr. Michael Pasha. How much you have to pay? I was not paid much less, and I have to see them quickly. So I think for 3 to 4 years already, Taiwan enjoyed the best healthcare quality, availability, and cost effectiveness. So we are in that. So what does that mean? So we have a nationwide, very standardized, very well-controlled healthcare service since 35 years ago. So we have developing a lot of network about all hospital clinics. They are all connected. Majority, 95% or 96% of the healthcare service is fully regulated under management by the government. Okay, it's good and bad. It's been that they have a cost content and make sure the quality. And so this is very new. Our Ministry of Health want to have a build up on AI strategy, evaluating AI in healthcare, because there's a lot of question about scientific validation and how we're going to pay. I mean, if AI is involved, are we going to pay more or less? So they are doing quite a few examples. I believe May and understand this cross hospital alliance for data. So it means all the hospitals connected, and we will go through AI. Right? and AI clinical trial design, executive analysis, and also health insurance reimbursement. They want to use the AI to reimbursement means that, oh, how can we saving some money in some item or service throughout the system? So because we are all connected in our healthcare service, so it's much easier to do now. AI is coming to that. And I would say that might be an opportunity for the student or in fact in Tufts that we can learn from your experience and try to see how will that work. How in a small country, small population, easy to do it, might be easier to do it. And this is a sample of examples. So we have a center, maybe Professor Tsai can tell you more because he is right over here. There's a lot of five centers, and we can easily work with these centers to see if you have some example you want to test. Am I having some problem or some barrier in over here? We could consider to doing that the kind of research analysis, and which is the right one is the one I work. So this is last one. So I think AI is helping the global health. Possibly, but there are some noise already around network crime. And you are the leading one. You're going to be the top of the mountain first. We are the second and third behind you. But even if you are the first one, you need to someone behind you. Because maybe something, the second one, third one will help you to work together. So we need a teamwork. And the teamwork are essentially important at this moment for healthcare with AI. I know you probably have some questions, but before I finish that, I want to present one of the most important contributions that link Tufts with us is Sabrina. And 3 years ago, we decided to offer an award to Sabrina, but because she was very busy. So now I have to ask her to come to the stage to receive this award. Oh. And this award is the EPOM Award, Health Literacy Award.
Wow.
Can I?
Yes.
I believe all audience on the sky will be very happy to read the message.
And this is a picture of your mom,
yes,
who passed a couple of years after we met.
I told you about a story of her journey in health literacy.
So just to say, this is a real honor in our field to receive this award in the field of health literacy, and I accept it by honoring your mom, who passed 2 years ago, Harris Berman, who also passed, who introduced us, the Dean of Tufts University School of Medicine, and both my parents, Gerald and Diane Kearns, who just both passed in the last couple of years. So thank you.